My name is Dr. Alex Quaas, and I'm the Medical Director of SGF San Diego. I think that egg freezing is probably of most value to women in their 30s, but it doesn't hurt to talk about it for women who are under 30 or over 40. At least you can explore the options. There are two aspects to consider. Number one, the younger you freeze your eggs, the less likely you are to potentially use them. But the older you are when you freeze them, the lower the quality of the eggs. And so a good sort of balance of these two aspects is potentially to consider it in the early to mid 30s. Generally speaking, the number of eggs and the quality of eggs that a woman has, they both decrease over the reproductive years. And freezing the eggs is an option to maintain some eggs at the quality that they're at the given age. There is no guarantee of a live birth, no matter how many eggs you freeze. And theoretically, also a low quantity of eggs could give a live birth in lucky and good and fortunate circumstances. But generally speaking, the live birth chance, or the chance of having a live birth with frozen eggs, depends on the age at which the eggs were frozen and the quantity of mature eggs that were frozen. After you get past a certain number, the relative increase in the probability of live birth in the future may become less and less and less. And so, in general, I say aim for about 20, but it depends on the individual circumstances. When a couple or an individual decides to freeze embryos, they must be aware that those eggs are now committed to the sperm source. The chance of conceiving with frozen eggs is similar to the chance of conceiving with frozen embryos. It's just that we do not know yet how many of the eggs will be destined to become embryos. But generally speaking, if someone is unsure of what the sperm source should be that they would like to have a baby with, then they should freeze eggs, because once they become embryos, you can no longer go back and turn them back into eggs. And so this is a personal decision. I would say from a medical perspective, both options are very good options.